Okay, so I'm Rachel Wanjema from Clear Minds, Better Lives, and I'm joined today by a special guest. So I'm going to give him the floor to introduce himself and tell us what he does.
Yeah, thanks, Rachel. So my name is Derrick Howell. I am native of New Jersey. I am a psychotherapist, licensed clinical social worker, and I've been practicing for the past decade. So a little bit about my background and what got me into the field of mental health. I grew up, experiencing and seeing a lot of individuals experiencing homelessness and myself with my friends and social network saw a lot of individuals who experienced trauma and other mental health that oftentimes went misdiagnosed or underdiagnosed. So, this was always something that was important to me to have clinicians that looked like you, that represented, your your culture and also some of the strengths and other characteristics that you embody to be able to speak to some of the issues that you're facing. So I wanted to make sure that I put myself in a position to answer that call.
Yeah, that's awesome. We're so honored to have you today, and we're really glad that we have a chance to just dive in a little bit on an issue. And it's really nice that mental health, I think, recently especially has gotten a lot of attention, and people are seeming to pay more mind and not afraid to really speak out, I say, and like talk about
Right.
issues that they might be going through. So today, our
Definitely.
topic is anxiety. And I think about in the midst of everything going on, especially with the virus and all
Yeah.
all the hardships that people are facing right now, not knowing what the future holds or even their present circumstances, maybe not being able to provide for themselves. But before we start, I want to ask, can you define what anxiety would be? Maybe like, I know there's a normal, like, anxiety where, of course, you're anxious about certain things, but at what
Sure.
point get to where like maybe you should seek some help or maybe you can't handle it yourself? What would that look like?
Okay, great question. So let me first start by saying thank you for having me on. And uh, also to respond to that question, anxiety, I think oftentimes just in passing, we use the word anxiety. So anxiety in the clinical perspective, there are multiple ways to look at anxiety. So there's something known as social anxiety. And there's something known, and what we'll sort of use in today's definition, which is generalized anxiety disorder. Oftentimes, with someone will say, "I'm experiencing anxiety." That's commonly what they're referring to. Which, like I said, us in the field, we would diagnose based on criteria and a diagnostic assessment. It would be generalized anxiety. So those symptoms need to be present for at least a minimum of 6 months. And if you are able to meet with a clinician and they can give you an assessment
Mhm.
and the duration of your symptoms and the intensity of your symptoms are lasting for long enough, then that would be the time that you would want to work with someone
Oh,
and seek a referral.
okay. And is that different when someone is like, oh, I'm having a panic attack? What is that different, or is that fall under the same umbrella of anxiety?
Yes, so it's under the umbrella of anxiety disorders, and like I was alluding to, there are different types of anxiety disorders. So there's that social anxiety, there's generalized anxiety disorder, and then there's also another category with just those panic attacks, and that is a little bit different than someone who is experiencing like what would be defined as that generalized anxiety disorder.
Okay.
So some of those symptoms may look alike,
Mhm.
and they may be similar as far as the excessive worry
Yeah.
and you know and having the physical symptoms, and like your body may begin to sweat, or everyone's symptoms may look different, but some of like those physical symptoms that you can readily identify, like, hey, this may lead to a panic attack, or hey, this may be my anxiety presenting itself.
Okay. And I think we were talking the other day with a few friends of mine, and it was just, we realized that it's so important to realize that everybody is different,
Mhm.
and how things manifest in different people is also very different. And keeping that in mind and being conscious of that when dealing with people. So even anxiety itself can look very different from person to person, correct? Is that what you're trying to tell us, right?
Yes, exactly. And different things can trigger your anxiety in
Right.
different ways. So, the same person may have their anxiety triggered, let's say, from taking a test.
Mm,
So they're in a classroom taking a test, they may become anxious while taking this test. And then some of those symptoms may look different where if they have anxiety with driving a car because they got into a car accident, that those symptoms and how it presents itself may look completely different, although it's the same individual experiencing anxiety within their own skin. So yes, it can look completely different.
yeah. And so growing up, I think I've had some friends who may say like they suffer from having panic attacks or they suffer from certain anxiety disorders. And it's very interesting because I think in general, I think it tends to be women that come forth and they express, especially when they're going through things, I think mentally, that are more forthcoming in sharing that. I've never really had a lot of guys express to me, oh, I think I'm having a panic attack, or like I'm really anxious. So from a male perspective, and I'm really glad that we have a male on our panel to kind of, expound on that. But can you explain to us how would it look like, even if a man is not openly per se, or a male is not openly saying that they're suffering from something, what are some of the things we can look at as friends, family members, peers that could kind of serve as ways to say, hey, I think something may not be going right? Or how do men tend to express that? What does that look like?
Wow, that is a very difficult question, but I do have an answer. So, again, it looks different for everyone. So, one, you know, way of noticing and identifying would be having like sort of a baseline. So, as a loved one or a relative,
Yeah.
what that individual, how their mood is, how generally they present themselves and they carry out their day-to-day activities. And so if things are to change, and if they also, again, another part of the anxiety disorders would be that social anxiety. If you begin to see that the way that they go and move in different spaces begins to change, and it may be due to certain external factors, then having that conversation may allow you to go back to that baseline and say, okay, well, something is a little bit different, or something is off, and to share a little bit more about how that may look in men. It varies. I have a private practice where I specialize in men's health, men's issues, and so I do work with a lot of individuals who have anxiety diagnoses, and then also experience symptoms of anxiety. And so each person will
Yeah.
wear that differently. And so it's difficult to give you a what can you look for, because I know there's some certain individuals who may repress, like verbalizing that they have any feelings of anxiety, and they may be fully committed to their job, or fully committed to other activities. So it would be so difficult to say, okay, well, this person is anxious right now because they're sort of like repressing it. And then others may become very isolated, or they may be withdrawn in conversations or with family that they tend to not be withdrawn with. So yeah, it like mental health is a very large and long spectrum.
Yeah. Okay. And so I think like once you see that someone has kind of they're not on that baseline, you can see that something is wrong. What are some ways to go about talking to someone? A lot of the times, like I'm currently in nursing school, and we learn things like, oh, if you see someone for instance, is suffering with like suicidal thoughts, this is how you go about talking to them. You know, when it comes to anxiety, how do we as loved ones and friends and family go about starting that conversation? I think that's what I'm trying to ask.
Yeah. So it's important. And again, like I typically uh, have that conversation and, catapult that conversation, you have to normalize others' feelings and thoughts. So it may be varying from a perspective that you may hold as the loved one who is asking the question, but you have to sort of meet them where they are. If this is how they feel, then you have to be accepting of that if you are allowing them that space to be vulnerable.
Right.
So that's super important. It's just listening. If you truly want to get a sense of how they feel and what their thoughts are, you have to be willing to listen and then respond that you can hear them. You may not accept what they're saying, or you may not agree, but you just have to be open so that they can also in turn be vulnerable.
Yeah, that's very important. Thank you. I think one other question we had is,
Yeah.
if you yourself suffer from anxiety attacks, anxiety disorders, that umbrella of things, what are some
Mhm.
things we can do personally ourselves to kind of handle it, to deal with it? What are some things we can do to alleviate some of that stress and pressure that comes with that?
Sure thing. So, there are some grounding techniques that can be used. There's also something that I love to use, which is reality testing. And, something great about this, it challenges sometimes those problematic cognitions and thoughts. And, you are able to put yourself in a different scenario and really judge, is this something that can happen or would happen based on these certain circumstances, and then you're able, again, like the name, you're able to test that reality, and that can reduce some of those symptoms of anxiety.
Mhm.
Also, like we were just sharing, speaking to a mental health clinician, speaking to a therapist. There are plenty of great clinicians and therapists and counselors in the world, and it's there's a lot of platforms nowadays. Like you said, this upcoming Friday is actually mental health awareness month, so excited about that as well. But yeah, definitely reach out to someone who is a qualified expert to get help.
Yeah, thank you so much. I think we've covered kind of like a basis, just like literally just the tip of the iceberg when it comes to
Yeah.
anxiety. But as we do approach that Mental Health Awareness Month, what are some things that, over the years practicing being a clinician, what are the things that you can tell us, or just important facts, anything, any last words, I would say, for us as we get into Mental Health Awareness Month?
Sure. Definitely practice self love, self care. And in addition, I think that self care is a very buzz conversation, hot topic, so to speak. I think it get misused or overused. And I think it's important to, when you're practicing self care and self love, to also uh, implement gratitude, because we may try to hold ourselves to a schedule. Like, if I don't journal, if I don't work out, then I'll sort of fall off of what I was setting out to achieve as a goal. And just giving yourself that gratitude of, I did work out 2 days, maybe the goal was three, but I had some other stressors come up, or maybe I just got a chance to spend time with family and loved ones, especially with everything going on in the world. It's definitely easy to get sidetracked from a goal, with having to stay in. But then you can also, turn that into a positive affirmation and to express gratitude. And it's one of the best things to do, like I said, especially right now, and move as we move into mental health awareness month.
Yeah, sure. So thank you so much. I'm so grateful. I think anxiety sometimes can be a topic that's overlooked just because,
Right.
like I said in the beginning, everyone experiences anxiety to some degree. So I think like people may feel overwhelmed sometimes or feel like something is wrong with them if they feel like that anxiety is getting out of control or out of hand. So I'm very glad we've had this conversation, and I hope that it brings a little more awareness to people to know that we're all different. We all have different struggles, but at the end of the day, we're human beings and we should be there for each other. We should be more compassionate and understanding and know that what someone is going through, you never know. You could go through the same tomorrow. So don't ever judge anyone and be vulnerable. And in turn, people will be vulnerable with you. And I've learned something today. And I thank you so much once again for allowing us to have you on our platform. We don't take you for granted, and we don't take the work that you do for granted. So thank you so much. I don't know if you have any
For
last
sure.
comments, any last remarks, but that was it for us. We're so happy, and we can't wait to see how this month goes with mental health awareness. And hopefully we leave an impact in people's lives.
Yes, well said, Rachel. And I thank you for having me. I think that we covered it all.
I think
Uh,
too.
Thank you.